Behind these doors, the wards where no one wants to be.
Just check this, all right?
Patients inside 7 East are all battling COVID-19. Jason Trubiano is head of the Austin Hospital's COVID wards. Right now, he's the busiest he's ever been.
Whenever we see these numbers of 300 or 400, we generally expect to see 10 to 20% of those present to us 5 to 10 days later.
His team must wear full protective equipment throughout their shifts. They care for coronavirus patients 24 hours a day.
These are people across a range of health backgrounds, young people, elderly people.
While some people do carry a higher risk of complications from COVID, doctors want it known it can be dangerous for all ages and harm those without underlying issues.
I think it's a really important message that young people can be equally infected. We've got people that are my age, and I consider myself young, still in hospital at the moment.
The confronting reality is that anyone can get terribly sick with COVID.
Right now, there are 30 infected patients inside these locked-down COVID wards, while downstairs in intensive care, a further 3 people are battling the virus, and staff are anxiously waiting on test results for another 2 patients who they strongly suspect have COVID-19.
For them and their families, this is extraordinarily terrible.
Inside the ICU, patients with coronavirus are quarantined inside these pods. For the safety of all, there are limits on who can enter. The work is demanding, the care constant.
We're working very hard to make sure that the workload is balanced by rotating teams and giving people some downtime where we possibly can.
The Austin Hospital was among the first to set up dedicated COVID wards and teams. And now as the state battles a surging second wave, staff are preparing. Already they've doubled the number of beds inside the ICU and added an extra 60 ventilators. The extra equipment is stored on site for quick access.
Not bleeding very well.
To the small number of those people still in doubt over the severity of this pandemic,
as someone who speaks to families of loved ones of people who are dying, let me assure you, to us and in healthcare and to those families of the sick patients, this is incredibly real.